Yeah, Brent, that's right. The final facility in the state of Connecticut to receive this vaccine was right here at Livewell Assisted Living in Southington. Governor Ned Lamont was on hand here today to mark the achievements. The sign says it all. Heroes work here.
This is a big celebration day.
But many of them aren't getting vaccinated. Healthcare union 1199NE is making videos to encourage taking the shot.
I would really like people to step up, my coworkers, my union members, and take the vaccine. We were all hoping to get a vaccine. Now it's here, and we don't want to take it.
Statewide, only about 40% of long-term care facility staff have chosen to get the vaccine. Livewell is an outlier at 90% uptake.
90%. You're going to get vaccinated, right? You getting vaccinated?
How did they do it?
By conducting Zoom meetings with one of our physicians, Dr. Ann Kenny. She's been doing group sessions both for staff and for family members.
In fact, Livewell is an outlier in a lot of ways. They've been able to keep COVID free for over 270 days until December 11th.
We did experience a few more positive cases, but only for 11 days. We managed through the use of negative pressure, N95 respirators, and extensive PPE to stop the spread after only 11 days.
Livewell conducts daily rapid antigen testing of all staff. They offer salary incentives for keeping the virus out. They even stood up an on-site grocery store.
It's a total legit grocery store, and we were packing groceries for people 3 times a week. When you put that bubble around people, you treat this as a total public health issue rather than a protection of a group of residents.
But most long-term care facilities running on a thin or negative margin can't do what they did. And as for as much success as Livewell has had, many long-term care facilities aren't nearly as lucky.
What's happening in the community often gets reflected in what's going on in the nursing home.
New data shows 67 new resident infections and 9 deaths at assisted living facilities, and 483 infections and 111 deaths at nursing homes just within the last week. Vaccine versus virus, a race against the clock to educate and inoculate as the levels spike.
So give it another couple more weeks. The second doses will be coming on time. I think you'll see a big difference made.
And Connecticut is still on track to complete both doses of the vaccine for anyone who wanted it in that Phase 1A group by the end of the month. Then they'll move into the more complicated Phase 1B category, which will include about 800,000 residents here in Connecticut. We're live in Plantsville. Matt Caron, Fox 61 News.